We start this semester with Chapter 1, Introduction to the Human Body, Principles in Anatomy and Physiology by Tortora. We're using the 15th edition in class. These videos are based off the 14th edition. There's not much difference except for some updated pictures here and there, but you'll have no difficulty using these lectures for the 15th edition all throughout the semester. In this chapter, we'll talk about the difference between anatomy and physiology, basically form versus function. We'll talk about different levels of organization found in the human body. We'll talk about the 6 different shared properties of all living things, and we'll compare and contrast humans versus a virus, and whether you're going to tell me whether a virus is a living thing or not. We're going to talk about the concept of homeostasis and how different mechanisms that are found in the body try to achieve homeostasis all throughout life, and why it's important to never actually achieve homeostasis. So anatomy is simply the study of a structure, whether it be talking about the molecular structure, cellular tissue level, or even up to the organ or even the system level. Why certain things are developed the way they are directly relates into how the physiology of how a body structure will function. If you alter the anatomy, you could potentially alter the physiology. This can be done down to the molecular level, all the way up through the cellular tissue or organ, all the way up to the system level. As we know, if we take away certain body parts, the body can still function up to a certain point, but take away certain very essential body parts, then all of a sudden certain types of physiology will basically be hampered, if not downright shut down. So we'll talk about different types of branches of anatomy in this course. Basically, after every type of chapter that deals with a particular type of system, we'll talk about embryology, how these things will develop. I don't get too in-depth with the embryology, mainly because embryology is its own course and really deserves a lot more study than the little snippets we'll get at the end of each chapter. We'll talk about the developmental biology. We'll talk about how cells differentiate from themselves and reach different stages as they start to mature. We'll spend an entire chapter on cell biology. We'll also look at different slides, look at the histology of different types of tissues, and again, really kind of see what how the structure will dictate how well certain things will function within each particular specimen. We'll also talk about gross anatomy, where I deal with, as a chiropractor, quite a bit. We look at the overall picture of how different types of structures will basically function within a whole system or whole organism. Look at systemic anatomy. We'll talk about how different systems will interact. And of course, we'll go in a little more depth into regional anatomy. So we'll look at individual bones. We'll look at individual muscles, how the nerves will interact, different parts of the brain, so on and so forth. In the Integumentary System chapter, which is the skin, we'll talk about surface anatomy in particular, and we'll identify different types of markings, either on yourself or on each other. And we'll get into imaging a little bit. We'll touch upon X-rays, MRIs, CAT scans. In fact, I brought in some of my own X-rays that were taken with some patients, as well as taken from other sources. X-rays are probably the most prominent imaging we'll look at, but I'll try and orient you to kind of get an idea of what kind of structure you're looking at, and also be able to extrapolate into what kind of function we may actually see with those particular body parts. But we'll also look at the pathological anatomy as well. So I'll show you the norm, and then hopefully I can show you sort of things that I've seen in practice, some things that you may see out in different biological fields. But we'll talk about how things go wrong. We'll talk about neurophysiology. We'll talk about a little touch of endocrinology. We'll get more into that into HAP 2. We'll look at a little bit of cardiovascular physiology, briefly touch on immunology, respiratory physiology, as well as renal physiology. Will be dealt more so with HAP 2. Now, as a chiropractor, again, I do deal quite a bit with exercise physiology. We'll spend quite a bit of time with that as well. And of course, now that we have pathological anatomy, we're of course going to look at pathophysiology and see what kind of disease processes will actually be shown in the general public. So we'll be looking at 6 different levels of structure organization within the human organism. I'm sure most of you will have some trepidation about going over it again, but we'll be going through the chemical level. So we'll be touched upon a lot of concepts back from both high school chemistry and biology. Basically, we're talking about atoms and different types of molecules, which are naturally the building blocks for the next level, which will be the different types of cells that we'll look at. We'll look at some cells, and we'll be dealing with some models here and there as well, which you kind of will develop on your own. during one of our labs. And of course, once we have a multitude of cells to make up different types of tissues, we'll talk about 4 main types of tissues in this chapter. Pretty much all the tissues that are found in the body will fall under one of these 4 categories, which we'll get into later on. Different types of tissues will combine to form organs, and we'll look at in particular, we'll look at the skin as an organ, we'll look at different types of muscles, we'll look at bone, we'll look at different parts of the nervous system as well. And of course, as we build up all these organs, we're going to have different types of systems all found throughout the body. And one thing we'll learn in this course as well is naturally if you alter one type of system, it's going to affect a multitude of other systems as well. So look at that interaction quite a bit there at the same time. And of course, this all builds up to form the actual organism. So also look at the organism as a whole based on any kind of alteration of the structures at any one of these levels, all the way from the chemical all the way up to the organism, can have dire effects. So of course, if you change the structure, it will also change the function too. So look a little more in depth with that. So in this particular course, we'll be looking mostly at the integumentary system, look at the osseous or the skeletal system. We're going to look at joints, muscle, and also nervous systems, both the peripheral and also the central nervous system. Now, I realize a lot of this will be redundant for a lot of you, but those of you who may not have been brushed up on your high school sciences, basically we'll kind of go through these terms once again. So for the chemical level, we're going to talk about your atoms, which are going to be the smallest units of matter found in chemical reactions. And the 4 most abundant essential atoms found in the human body will include carbon, hydrogen, oxygen, and nitrogen, followed by different types of lesser elements or trace elements, such as phosphorus, calcium, and sulfur. We'll talk about more of these we get into the next chapter, we get into the different chemical levels. And of course, these will build into different types of molecules, which will naturally be at least 2 or more atoms joined together. We'll talk about some smaller molecules like oxygen, carbon dioxide, as well as the macromolecules. We'll look at different types of proteins. We'll look at different types of carbohydrates, as well as different types of fats. So as we know, glucose is the main sugar used in the body for energy. DNA, of course, is very important for the actual function and the driving force of the cell. We'll go through more of these into the next chapter. The cellular level, we'll talk about different types of molecules that form the actual cells, and these are going to be eukaryotic cells. In chapter 3, I believe, we're going to get into different types of cells, both the haploid and diploid. We'll get into different types of function, where you're going to find them in the body, how to differentiate one type of cell from another. And again, this, for a lot of you, may actually be very familiar material to you, but we're going to go a little more in depth with different functions of cells. Particularly, again, at this stage, we'll start looking at when certain cells, when they either start to die off or unless they don't function properly, what kind of cascade effect you can see to other cells in the surrounding area. And of course, we'll get into tissues. The 4 basic levels of tissues will include epithelial, connective, muscular, and nervous, and we'll get into the chapter 4, I believe, with different types of tissues. Basic epithelial will be basically your skin, all different linings that you'll find through the gastrointestinal tract, as well as lining most of your major organs. Connective tissue is the catch-all category. This includes blood, it includes cartilage, as well as a multitude of other things. Muscular, we'll talk about the 3 different types of muscular tissue that we're going to find. And of course, we'll finish up, in fact, we'll do quite a few chapters on the whole nervous system, easily 5 or 6 chapters towards the end of this semester. So that's probably where we're going to get mostly a lot of in-depth information on these different types of tissues and how they function. At the next level, we have the organs. So basically, we have a multitude of different tissues will come together to form an organ in a very specific shape. For example, a muscle, let's say the bicep, is going to have striations found parallel to where it'll actually contract to form the function of actually moving a joint, in this case an elbow and or the shoulder, depending on how much movement that we're talking about. But we'll go in depth with most of the muscles in the particular system and how they work with the joints and also the bones. We'll touch upon the different types of organs found in the cardiovascular system, as well as the gastrointestinal system, and also reproductive, but we'll spend most of our time on skin, bone, joints, and muscle, and also nervous. And of course, we'll talk about different types of systems found all throughout the body. And we'll touch upon all 11 of the systems in a few minutes, but we'll focus a little more so on the systems that we talked about previously. Basically, we'll go through the different types of organs found within a particular area, and how they all function as one particular unit. As I mentioned before, it's very difficult to have one system not affect another. So if a system starts to break down, something else will also start to suffer from those consequences. When we start to look at homeostasis, you'll see how one little particular type of mechanism or one form of metabolism, if that starts to change too much away from homeostasis, then you'll start to see things start to break down and things start to die off and cause all kinds of havoc all throughout the body. So Chapter 5 will talk about the Integumentary System. So naturally we'll talk about how the skin will protect us from the outside environment, but also is a huge organ that has quite a bit of sensory information coming in from it. So basically we'll have most of your touch sensations, your tickle sensations, even your pain sensors are going to be found within the Integumentary System. In this course, we'll also talk about the muscular system. In particular, we'll focus mostly on skeletal muscle. We'll touch upon cardiac and smooth as well. But we'll learn the majority of the skeletal muscles found in the body. We'll learn this quite in depth as well. In fact, I've broken this particular chapter, which is Chapter 11, down into 2 parts to make things a little bit easier. There is quite a bit of information there, and we'll try and break down by partitions of each particular body part. You will have to learn the name of the muscle, the action, the origin and insertion, how it actually attaches, and also how it is controlled by what nerve of the nervous system. So we'll talk about how the muscles will produce body motions or maintain position or posture, and also produce heat, which actually keeps the other body functions working, and also make sure that our proteins are working at the optimal temperature. Another thing it does here that is not listed on this particular slide is it does act on the venous system to pump blood through the venous system as a secondary function. We'll get into briefly talk about arterial pressure and how the difference is through the arteries as far as the venous system in particular. This is more so a reservoir. We see people that are very sedentary. We tend to see swelling or even worse, pitting edema. The first thing you try and do is get that particular joint and muscles moving, and that helps kind of literally pump some of that fluid back out of the area. Get it flowing through the body the way it should. And of course, we'll talk about the nervous system. This will be quite extensive. We'll get into the brain, spinal cord, which is comprised of the central nervous system. We'll look at the peripheral nervous system, and we'll look at different types of sensory organs, the eyes, the ears, the tongue, and also look at how all these different things will integrate with different parts of the brain and also the spinal cord and all throughout the peripheral nervous system. How the body will take a stimulus and will follow the path of how it's integrated or how we make decisions through the brain and how the body will act upon different types of stimuli. We'll touch upon briefly on the endocrine system. This is more so for HAP2, and again with the cardiovascular system as well. We'll look at both of these, how they apply to the other systems we had talked about. So we'll look at the endocrine system and how it will affect, say, bone growth or muscle growth, or how this also will impact how the nervous system operates. And same goes for the cardiovascular system as well. We'll talk about blood flow to the brain. But again, this is mostly for HAP2. Lymphatic system immunity, we'll talk briefly about that, how it occurs with dealing with viruses and or any other kind of foreign pathogens, but we will look at this more so in HAP2. The respiratory system we'll talk about briefly. More so we get into the chemical level. We talk about oxygen and carbon dioxide exchange, but for the most part, again, to go more in depth is more so for the second part of anatomy and physiology for humans. Digestive system, we'll talk about that more so. We get into different tissue levels as well as the urinary system, but again, these are more so for HAP2 and how these will directly affect the skin system as well as the skeletal system, muscles, and also the nerves. Now, the reproductive system we will touch upon briefly as we get into cellular mitosis and meiosis. We won't get too much further into that, but again, this is more so for the tail end of HAP2. And finally, we'll look at the organismal level, which will look at all different 11 systems together and how the whole body will function as a unit. We'll look at how things look at when they're normal and also I'll try and integrate depending on what chapter that we're dealing with. We'll try and see what systems or see what kind of dysfunction we'll see in those systems, what kind of pathology we'll see, and how it's going to affect the organism, both from the micro and also the macro scale. In your first lab, we're going to be learning about what's called non-invasive diagnostic techniques. So what does that mean, non-invasive? So very simply, we'll not be poking anybody with any kind of needles. We won't be penetrating any kind of orifice, whether it be the mouth, the anus, or anywhere else. You won't be doing any kind of diagnostic tests, such as doing a urinalysis or doing any kind of x-rays or CAT scans, MRIs. So basically we use 4 different types of techniques to basically get a general idea of how well a particular organism, in this case a human, is doing. The 4 will be simply the inspection, palpation, auscultation, and percussion. So inspection, very simply, for those of you getting into any of the health fields, whether you become a physician, a nurse, physical therapist, massage therapist, you name it, the most important thing for you to do is actually to inspect the person as they walk into your office or clinic, how they get themselves onto an examining table, or how they get themselves in and out of a chair. All these things we'll be looking at in the lab can give you a multi information of what to do next as far as if you need to order tests. Someone who walks in pretty easily without any visible type of changes to the body, let's say if the skin tone looks good or the muscle tone looks good, you're not going to order any unnecessary tests if you simply don't see anything, any real reason to know any kind of disease process going on. Palpation, which we'll do in lab either on yourself or on other people, is the art of touching body surfaces with your hands. We'll talk about different types of prominences you may feel on yourself. For example, the back of the head, there's a little bump there, which we all have, called the EOP, or the external occipital protuberance. That is supposed to be there. Some are formed a little bit differently than others. So I'll be able to kind of guide you into palpating these particular things and give you an idea of when something feels normal and when something feels relatively abnormal. Now, of course, that's going to be for almost a whole nother career. It takes a long time to get a good sense for palpation, so we'll just touch upon, literally, we'll touch upon this very briefly on how to palpate, and of course, if you decide to do anything further, it's definitely cause for further study. We'll touch briefly on auscultation. We do have stethoscopes in the lab. We'll listen to body sounds, in particular, listen to breathing, and also to the heart as well. This is also an art to pick up little things that you may note when someone takes a deep breath in or out. You may notice some wheezing or notice some crackling and popping, which is indicative of different types of problems. So again, we're not going to be diagnosing anything off each other, but just give you a general idea of the different types of techniques we'll be using. And we will listen to the heartbeat as well. Sometimes if you can listen in a really nice, quiet environment, which unfortunately the lab will not be, because there will be a lot of ambient noise going on, it may be kind of tough to pick up little things, but in general, I'll teach you guys how to auscultate and just kind of get a general idea what to listen for in particular. Percussion is something that's not done in most of the health fields, only in certain types. For example, percussion is mainly used a lot with respiratory issues or checking the gastrointestinal tract or genitourinary tracts. Percussion, very simply, is the same thing you would kind of assume with a drum. You're percussing or tapping on body surface with your fingers and kind of listening for any particular type of sound. So we get into lab, we'll talk about certain types of organs should sound dull. So if you tap on a bone, it should be dull. If you tap on, let's say, the stomach, it should be tympanic or sound like a drum because it has a level of liquid there and there's some air trapped on the top. So it should sound somewhat like a drum. And of course, if you tap onto the lungs, you have almost like a resonant type sound, like a very, very slight echo because the majority of the tissues are relatively small because they have air pockets found within the lungs. If we hear anything different than those 3 things, then we know something is wrong with the actual structure of a particular body part, and then therefore we kind of get an idea how well it's functioning. So we'll go through that a little bit there as well. So let's talk about the 6 different types of basic life processes. So this is how we determine whether something is truly alive or whether something is not alive. So the 6 kind of processes we found in humans include metabolism, responsiveness, movement, growth, differentiation, and reproduction. So I want you to think about this as we go through each one, because you're going to answer just as you would in almost all of the lectures here. You'll be answering questions and then submitting it to me as your homework, basically. Think about whether you feel a virus will fall into these particular types of categories of life processes, whether it's actually true or not, whether they would fall in line with being human, with a human as being alive. So we look at metabolism first. So metabolism will be the sum of all the chemical processes found in the body. So it's going to be broken down into either catabolism, which is going to be the breakdown of complex molecules into smaller components, and the flip side of that will be anabolism, which is going to be the buildup of the complex from the simple components. So very simply, if you just think about the simple breakdown of eating table sugar, where it breaks down into glucose and fructose, how they can be restructured to form either other carbohydrates, or it can be converted into ATP. It could also be the breakdown of proteins found in meat that you may have eaten last night for dinner, and breaking down the amino acids to build, say, muscle in a totally different part of the body, or build the body-brain barrier found within the cardiovascular system. We also look at responsiveness, how the body is able to both detect and also respond to changes. So this could be something at the micro level. So it could be checking for oxygen levels found in the blood. It could also look at the actual pressure of blood. Also be able to respond to things in the macro as well. So able to detect whether it's actually cold outside, so put on some kind of another layer of clothing. Other things would be actual decrease in body temperature, responding to different types of sounds. Let's say if you lost your dog and trying to find out where he or she might be responding to sound and be able to detect the difference of the sound of your dog's bark going from one ear to the other, can help you orient to where that particular dog is coming from. We'll look at different types of responsiveness as far as nerve signals. We'll look at different types of things where if you smell a certain type of odor, whether it be gas in a house or whether you smell grandma's apple pie, basically what kind of responsiveness you would have to that particular type of stimuli. Movement, we'll talk about everything again from the micro to the macro. So we could look at the entire motion of the whole body as someone moves through a particular space. We'll look at different athletes of how they do particular things like throwing a javelin or possibly swinging a bat. But also we look at movement too of these small molecules as well. So the flow of blood or exchange of different types of gases like oxygen and carbon dioxide. So we'll look at this both from the macro down to the micro as far as movement goes. Growth. So growth can simply mean increase the size from either making the cells bigger, in this case for fat cells. Fat cells will basically have the same number of fat cells as we grow, but the fat cells can get bigger and bigger and bigger. Or we can increase size for muscles, let's say, or increase size, let's say, in certain types of epithelial layers by adding simply more and more cells. So we may also look at how the bone, how it will respond to different types of pressures, where certain types of cells will increase, or possibly the growth materials between the cells will increase as well. So all this can fall under the growth life process. Now, differentiation is going to be important. This is where we talk about cells that go from the unspecialized to the specialized. So we'll talk about how the sperm and the egg will come together. We'll talk about different types of cleavage points and at what point we start to see the first type of differentiation. We'll also talk about how different types of stem cells will give rise to different types of differentiation as well. We'll talk about special cells found, osteoprogenitor cells, which are in bone cells, how they follow from osteoprogenitor cells to osteoblasts to osteocytes. We'll talk about a different line, which osteoclasts, and how they differentiate into different types of things. Look at those lines as well. Of course, reproduction. Reproduction can be one of two things, either formation of new cells for repair or growth. We'll look at skin, how it's rapidly, it's kind of a layer that will be rapidly metabolically dividing as we continually shed our skin over and over, or to the entire process of the production of a new individual, with two haploid cells forming a diploid cell, and then of course from that one cell differentiating itself into a full human being. So, question to you very simply. So human versus a virus. Is a virus alive? What I'd like you to do very simply is, through your own research or through your own knowledge, I want you to apply each one of these 6 life processes: metabolism, responsiveness, movement, growth, differentiation, and reproduction. So I've already shown you how the human fits in all of these 6 life processes, and I want you to present your argument to whether you feel like a virus is alive or not, and tell me which life processes it falls into, so it would be alive, or which ones it would not be. So if you have to go back again, by all means go back through the last couple slides or go through your book, or feel free to search online and see what kind of records or some kind of research you can pick up from that as well. I have my own idea. I know it is definitely up for debate with different types of life processes, but I'd like to hear what your response is, which can be submitted either by paper or you can submit online, either through Canvas or through Blackboard, if we're still using it at this time, or you can just email as well. So next type of clinical connection, other than doing the 4 non-invasive techniques, would include autopsy. Some of the pathophysiologists a lot of times look at the body post-mortem, which means after death, and they'll do the full examination of the body's internal organs. So they'll take very exhaustive notes on skin tone, they'll look at muscle tone, they'll look at things found under the fingernails, look at things at different types of orifices. They'll actually weigh internal organs. They'll detect any type of tumors that may be found in these organs. So these are very important, especially for anybody who has died under very mysterious circumstances. Helps determine the cause of death. It give you an idea of what kind of diseases that were not detected throughout the life. Also determine the extent or the contribution of injuries to the death, and finally also look at hereditary conditions and whether someone actually did inherit a particular thing from mom or dad, and give us a better idea of whether their progeny may have some of the same problems later on. It's very important, especially if you're looking at different types of cancers, because some of it can be hereditary. But this is a very intriguing form of science. So you have to have a very strong stomach to do some of these things. Those of you who do move on into different fields of study, in particular for nursing or looking into getting a medical degree, you'll be doing gross anatomy on this on cadavers. It's a slightly different process, but you do get to see all different organs. You get to actually hold some of the organs too and kind of see how they feel. But the autopsy course is very, very important for helping determine different types of contributing factors to death. So homeostasis. Homeostasis is termed as a condition of equilibrium or balance found in the body's internal environment. So this is going to be maintained by a lot of different regulatory processes. So basically homeostasis is going to be that balance point that you're trying to find throughout the body, through all kinds of different mechanisms, whether it be through temperature, whether it be through blood pressure, whether it be to oxygen and carbon dioxide levels, glucose levels, you name it. There's a lot of different homeostatic processes that go on throughout the body. And we'll look at 2 different types in particular of types of homeostasis. One, we'll talk about negative feedback, and we'll talk about positive feedback and give some examples for each. So naturally, our survival depends on our body's ability to try and maintain homeostasis in all through the bodily fluids. So very simply, this fluid is known as extracellular fluid. This is going to be found outside the cell. And the pH balance is going to be very important on these fluids. Now, some may change here and there, but very simply, you want a pH balance of around 7.4. We'll get into pH a little bit more. This basically talks about the hydrogen and hydroxyl ions found in a particular fluid. If it skews too much or too low of a pH, then it's more acidic. It has too high a pH, it goes more in the basic area. We'll talk about different types of cells in particular that contribute to different types of pHs found in most of the extracellular fluids. So we'll go through more of these when we get into each individual chapter, but these different types of extracellular fluids, known as blood plasma, which you find these within blood vessels, both through arteries and veins. We talk about lymph, which is going to be found within lymphatic vessels. CSF, or cerebrospinal fluid, is going to be found bathing the brain and spinal cord. We'll go through this a little more in depth. Basically what this does, it helps nourish and also protect the brain and spinal cord. And we'll talk about how it's produced and how it's replenished at the same time. Synovial fluid, which is found in joints. We'll talk about why that's so very important and how, as we age, we start to lose that. So we'll go through the major joints found in the body. We'll look at the eyes as part of the special sensory organs in the latter chapters of the nervous system. We'll talk about the aqueous humor as well as the vitreous humor, also known as vitreous body. So there's extracellular fluid found in the eyes. Now, for most of these interaction animation, I'm going to let you click through these yourself. You should have your own copy of Tortora's Principles of Anatomy and Physiology through Wiley+. Basically, this will just kind of back up what I'm talking to you about here. So I encourage you all to click through that particular animation, let it flow through. You just click through it once, and it should take through each of the major stages, and then come back to the next slide. So we talk about homeostasis, which we're going to talk about 3 different types of components here. You must have a receptor, you must have a control center, and an effector. So very simply, the receptor is going to be the part of the peripheral nervous system that's going to detect some type of chemical signal, some kind of change. It's going to send the information or send an impulse to a control center. That control center is going to act upon that particular information from the receptor out to the effector. It's going to bring about some kind of change. So what happens is we have some kind of stimulus, whether it be some kind of disruption in homeostasis. Let's say if something's too cold or something's too hot. Or let's say we don't have enough fluid in the blood or not enough oxygen in the blood. This particular stimulus is going to have some kind of effect onto the receptor, which is going to give information to the control center, which is going to act onto the effector. It's going to change or make a change to the response. It's going to alter a particular type of control condition. So in this case, hopefully it'll help it return back to a homeostatic state. We have 2 types of feedback loops that helps us maintain a level of homeostasis. The first one being a negative feedback loop. Both the negative and a positive feedback loop have the same components. They both have receptors, both have a control center, and both have effectors, but they operate a little bit differently. The negative feedback loop is good for keeping a certain type of process within a certain range. So for example, blood pressure, oxygen concentration in the blood, blood sugar, as well as a few other things including temperature. You want to try and keep things within a certain range. So very simply, if you have something that's too high or something is in a hyper kind of situation, the negative feedback loop allows the receptors to detect that. It sends information to the control center and sends the effectors to actually bring down the hyper type of stimulation and bring that down again within a certain range. So think of it almost like a seesaw effect, where very simply you're teetering back and forth between the balance point, but you're never actually really achieving that balance point. You're simply going back and forth, trying to maintain a certain range. Next type of feedback loop that we have is a positive feedback loop. We don't see these quite as much as negative feedback. The positive feedback very simply is a ramping up of a certain type of stimulus. Shown here is basically given the birth of a baby. Other types of positive feedback loops would be blood clotting. But for the most part, the positive feedback loops will talk about expelling something from the body. Think of vomiting. Think of any kind of urination or defecation. But in this case, we're looking at the birth of the baby. So as the strength of the stimulus will increase on the receptors, it sends more and more information back to the control center. And once it actually ramps up to a certain point, it's going to trigger the effectors to basically, in this case, expel the baby through the birth canal. Once that stimulus is gone, then all of a sudden that positive feedback, the receptors will calm down, and then there's no more feedback going on through the control center. So those of you who have been to one of the water parks, if you've ever been in some of the parks where they have like a big bucket or a big ship, think of it slowly filling up with water until it hits a balance point, and all of a sudden then it dumps the water on all the people below it. Kind of the same thing happens here with the positive feedback. So again, as long as there is a stimulus that keeps increasing, it'll eventually hit a balance point through the control center, trigger the effectors to basically expel this particular, in this case, the baby, or in the case of vomiting, obviously anything that's left in your stomach that's toxic, or if you're urinating, defecating, basically once that eliminated substance is gone, there's no more stimulus, and then basically everything returns somewhat close to homeostatic state. Now, homeostatic imbalances, if they're going too far out of the range, whether it be either a negative or through a positive feedback loop, that's when all hell breaks loose. If you had gone through the animation before, basically sometimes it goes through medical intervention and it has to be caught in a relatively short period of time. Another point of importance, very simply, is there's only one point where you actually have complete homeostatic balance, and that's when you're dead. That's basically when all the processes have stopped and basically achieve the ultimate homeostasis there when none of the processes are functioning whatsoever. So again, differentiate between a negative feedback loop and a positive feedback loop. Think of a seesaw over a balance point for the negative feedback loop. So in the saying in the medical field, we say we're trying to hyper the hypo and hypo the hyper. So it's constantly going back and forth over that balance point. Talking about the positive feedback loop, that is where you're going to increase the stimulus response, and the control center will detect that. And once it hits a certain point, it basically overloads the system and allows the effectors to expel whatever process needs to be expelled to basically bring the stimulus down to a tolerated point. Next, we'll be talking about basic anatomical terms. So very simply, when we deal with anything with the human body, there has to be some form of standard, whether it be about positions, whether it be about body parts, directions, so on and so forth. I myself have dealt with doctors from other countries, mostly from Canada and from Mexico. I've had a few doctors that have sent me records from Africa. We all have a standard basis for different types of parts of the body. Without so, it would be very tough to communicate from one doctor to another, or one physician to a physician, scientist to scientist, about certain types of problems or pathologies, and so on and so forth, because it's all about the care of the individual patient and what's best for them. So in this course, we'll talk about different types of body positions, what the standards are. We'll talk about regional names. We'll talk about directional terms, which we're going to use quite often, in particular when we get into the skeletal system, the muscular system, as well as the nervous system. And we'll also talk about different types of planes and sections, which is very important for those of you who may get into performing diagnostic testing, or possibly reading diagnostic testing, or very simply diagnosing off of those particular tests. And also talk about the body cavities and what kind of organs are found therein. So first, the anatomical position. This is the standardized method of looking at a person and looking at the body that allows us to be more precise and consistent from one clinician to another. So very simply, the person will stand erect. You're going to face the observer. The upper extremities are going to be placed at the side, with the palms of the hands are going to be turned forward. In this case, we call it anteriorly. So if you're looking at the particular person, the palms are facing you. Also, the feet are flat on the floor. So again, this is known as the anatomical position. So very simply, if I'm talking to someone else about a particular person, and I may interchange person with patient or examinee, very simply, we're talking about the patient's left and the patient's right. So even though their left side may be on my right, we're talking in reference to the particular person, the patient themselves, or the examinee. And again, if I mention observer, I may say the examiner at the same time, or clinician. In this course is pretty much going to be synonymous for those terms. So the anatomical position, very simply, the body is upright. We also have different types of terms for the reclining body. So the prone position is laying face down. Supine position is known as laying face up. Regional names. This slide in particular is probably going to be the most important slide of this particular chapter. We'll be using this quite often, especially when you look at the gross anatomy of the skeleton, as well as the muscle system and also the nervous system. We'll be using these all throughout the semester. So in this particular sense, there will be some cumulative terms that we use in the final, although I'll talk more about that as we get into the examinations later on. But if we go a very quick breeze through this, we're looking at different areas of the head, and it's going to be broken down to both the cranial and the facial areas. That can be broken down a little more so when we get into the actual structure of the skeleton of the skull. We'll break it down into different types of areas, such as the frontal area, the temporal area, the orbital or ocular area. And we'll go through these a little bit more so when we get into the actual lab part, where you're going to use the common names, and we're going to try and use more of the anatomical names. So we won't be using forehead, we'll be using frontal. We won't say mouth, we'll say oral. Other areas we'll look at the thoracic area, known as the chest, the pelvic or the pelvis area. We'll use different areas like the axillary for the armpit, the brachial for the arm, and so on and so forth. If you skip down, look at more of the pedal area, we'll be talking about the tarsal area, known as the ankle, and also the phalanges, which you're going to find on both the toes and also on the fingers. We'll talk about different areas called the dorsum, top of the foot, as well as be a dorsum of the hand, so we'll be able to differentiate one from the other. And also, as myself being a chiropractor, we'll talk a lot about the spinal areas, as well as the dorsum, also known as the thoracic spine, the lumbar, lower for the low back, the sacral area in particular there as well. But again, we'll go through more of these when we get into lab. We'll look at this slide again we get into our first laboratory experiment. And probably the second most important slide is the slide you see here for directional terms. You will need to memorize these and be able to differentiate one from the other. It will help you be able to identify certain parts on bones. It will help you to identify how a muscle is going to originate and insert, as well as the function of those muscles, and also how well the nerves will be distributed all throughout the body as well. So if we go through each one, very simply, we have superior versus inferior, so pretty much top to bottom, so above or below. One that's not shown here is going to be anterior and posterior, which means front to back. So anterior is going to be what you're seeing first here, so that's our facing us is going to be the anterior portion. What we cannot see on this slide is the posterior portion. So look at that a little more closely in another slide or two, especially when we talk about the planes in particular. Now, two types of directional terms that a lot of people seem to get mixed up here is going to be lateral to medial and proximal to distal. So very simply, the midline here is how you're going to differentiate medial to lateral with the trunk. So very simply, if it's closer to the midline, it is medial. If it's further from the midline, it's lateral. But again, only with the trunk. We talk about proximal and distal. This is more so to differentiate the areas of the extremities, both the lower and the upper extremities. So very simply, if the proximal area would be closer to the trunk and distal will be further away from the trunk. So in this instance here, the shoulder is going to be proximal to the elbow, and the wrist is going to be distal from the elbow. So again, the wrist being further away from the trunk would be distal to the elbow, and the shoulder be proximal to the elbow for the upper extremity. And we can extrapolate that too with the lower extremity as well. Very simply, look at the hip. The hip will be proximal to the knee, but the ankle will be distal to the knee. So again, the medial to lateral as well as the proximal distal is not interchangeable. So you basically want to look for medial to lateral with the trunk and proximal distal for the extremities. Another one not pictured here is going to be superficial to deep. So in particular, when we talk about the layers of the skin, superficial is going to be further out to the periphery of the skin area, usually to an exposed surface. And deep is going to be actually the deepest portion of the particular body part, whether it be the extremity or the trunk. Next, we'll talk about planes and sections. So basically, these are going to be flat surfaces that are going to divide the body, sometimes not equally, but at least it'll differentiate between, say, anterior and posterior, or say superior to inferior. But again, these planes could be almost like slices of the individual body, and we use these in particular. We look at different types of diagnostic imaging, in particular CAT scans and MRIs, just name a few. So let's look first at the frontal plane. The frontal plane is also known as the coronal plane. Frontal plane is going to separate the body into both anterior and posterior portions. You look at the sagittal plane, which is going to differentiate from left to right. We're going to see different types. What's called the mid-sagittal plane goes right through the center of the midline. So in this case, it goes right between the eyes, down the bridge of the nose, down through the sternum to the pubic symphysis, and it's going to bisect the knees and the ankles. If it's off to one side, is known as a parasagittal plane, or just off center. The third plane you'll normally see is a transverse plane. This is going to separate superior to inferior. The last one you're going to see, although not quite as often, is known as the oblique planes. So this is pretty much where it's not going to fall along the angles of the frontal, the sagittal, or the transverse planes. So here's a quick little example of how the brain looks in all three planes. So you have the mid-sagittal plane, which is going to slice the brain in left and right portions. The frontal section is going to show the anterior and posterior portions, and of course the transverse section is going to slice it into the superior and inferior portions. So the body cavities that you see here, you notice that there's going to be three, each with individual partitions. The most superior and also the most posterior portion is going to be the cranial cavity and the vertebral canal. This is going to be continuous. They'll house the brain as well as the spinal cord and also the beginnings of the spinal nerves. In the blue, you'll see the thoracic cavity, which is going to be further differentiated into the pleural cavity, the pericardial cavity, and the mediastinum. So this will house the lungs, the heart, as well as the major blood vessels, at least in the thoracic area. Finally, see the abdominal pelvic cavity, which is going to have a soft partition between the abdominal cavity and the pelvic cavity. So the abdominal cavity will have the stomach, the spleen, liver, the small and large intestine, as well as the peritoneum, which is the inner lining of the abdominal cavity, where the pelvic cavity is going to contain urinary bladder, parts of the large intestine, as well as the organs of reproduction. pericardium and the pleura are going to cover the heart and lungs respectively. You're going to see the different layers of the pleura here, which is going to have the pleural cavity, followed by the parietal pleura, which is going to be the outermost section, as well as the visual pleura found closest to the surface of the actual lung itself. Found within the pleural cavity is going to be serous fluid, which help maintain a certain viscous and lubricated type of essence for the lungs. Those people that have a diminished portion of the serous fluid in the pleural cavity will have what's called a dry rub, which can be very painful because basically friction on both layers of the visceral pleura as well as onto the lungs themselves. You have the pericardium, which is going to house the heart. So you have the parietal pericardium, which is going to be the outermost section of the pericardium. You also have pericardial cavity, also filled with serous fluid, and also the visceral pericardium, which is going to be right up against the actual surface of the heart. And of course, the mediastinum will be the innermost portion, is going to house the superior vena cava as well as the aorta. Here's a transverse section showing the area of the lungs as well as the heart. In fact, you can see the tricuspid valve there as well. You're going to see a portion of the thymus. So very simply orient yourself a bit here. You have the anterior towards the top portion of the slide, posterior at the bottom portion of the slide. Looking at this particular patient, so we're actually looking from an inferior view. So the left pleural cavity is on the right side, and the right pleural cavity is going to be found on the left side. This is known as a transverse section, looking inferiorly to superiorly through the thoracic cavity. Now, the peritoneum is going to be a special covering. It's going to line the abdominal organs, except for the kidneys, adrenal glands, pancreas, inferior vena cava, the abdominal aorta, duodenum, ascending, descending colon. These are going to be what's known as retroperitoneal. So in other words, they will be found on the posterior portion of the abdominal pelvic cavity. This is going to be that's actually a very good test question, so you definitely want to learn these in particular. Just as we find in the pericardium and also in the pleural cavity, the visceral membrane is going to cover the organs. The parietal layer is going to line the abdominal wall. Now, this slide is not in your text. This is actually from an old text that I've had that I managed to dig up. It's a nice little shot, although it's a little bit on the small side, to show which organs are going to be retroperitoneal, so therefore behind or posterior of the peritoneum. So if you look at the slide here, you have anterior at the top of the slide, you have the posterior on the bottom of the slide. You've got the peritoneum is going to be lined just anterior to the pancreas, if you can see right through there. You see a very thin line. This is going to be the peritoneum. So you can find the pancreas as well as the inferior vena cava, the abdominal aorta, as well as both kidneys are going to be found posterior or retroperitoneal to the peritoneal layer. And just ahead of that, you see the spleen, or just anterior to that is going to be the spleen, the stomach, and of course a large portion of the liver. Now, we draw up the abdominal pelvic area either into 9 regions or 4 quadrants. Most people that deal with gastrointestinal, we're going to differentiate it into 9 regions. Most doctors that don't deal with the organs very much, will usually go in the quadrants just because it's simply easier. So the 9 sections of the abdominal pelvic region. If you orient yourself at the umbilicus, which will be dead center, so if you're looking at tic-tac-toe, it's going to be the center square. That can help you differentiate between which areas are going to follow next. So naturally, again, looking at the posterior specimen, the left side is going to be to our right. The right side is to our left. So the different areas will include the hypochondriac region, which is going to be the left and right upper areas. You're going to have the epigastric region, which is going to be where the stomach will lay. The second row there, you're going to see the right lumbar region. So remember the lumbar being low back. You have the umbilical region, dead center, and then the left lumbar on the opposing side. And then think of the inguinal or the iliac area. This is going to be where the testes are going to be area, as well as the inguinal ligament. You're going to find also the portion of the bladder as well as the uterus as well. So you're going to have right and left inguinal area there at the same time. And very similar for the quadrants. We simply have 4 quadrants. It's basically going to pass through the umbilicus, both the vertical and horizontal lines. Very simply named the left upper quadrant, left lower quadrant, right lower quadrant, and right upper quadrant. It is helpful to know for this course, although I will not ask you too much, which particular organs are going to be found in each quadrant, and also which will be found in each of the 9 regions of the abdominal pelvic cavity as well. Like I said, you may see 1 or 2 questions there on the next exam, but I'm not really going to hold you hard and fast to those particular sections. Last, we'll talk about medical imaging. So when we talk about the different planes, we talk about the different cavities and different regions. Naturally, we have very invasive style of medical imaging help us diagnose and treat different types of anatomical abnormalities. So in the case of a recent trauma, medical imaging is very important. It gives us an idea whether something is can be catastrophic or if something's simply unstable. Somebody's coming in for less than traumatic reasons. Let's say they're not responding to treatment, or let's say we need to be able to diagnose whether certain types of medication may be needed or dietary changes may need to be made. Medical imaging gives us a nice little invasive way of differentiating one type of body part from another. So one of the things that's a hallmark for any medical imaging, especially those of you who may get into medical engineering or biomedical engineering, very simply, the best type of medical imaging is when we have a very high contrast to be able to differentiate one body part from another, even when they're very close together. So one of the most people think about is radiography, also known as X-rays, which we use quite a bit in our office. I send people out for X-rays somewhat often, not every person, but you will see some X-rays quite a bit because it's a nice little way of looking at anatomical structures and be able to see how they look in real life through the X-rays. Most of the patients that I have some copies of X-rays that I've used in the past. So it's a great way to look at bone and hard tissue. Occasionally you can infer certain things from soft tissue, and depending on the size of the person, sometimes some things may look a little more radio-opaque, very simply meaning they're more white, or more radiolucent, more black. But we'll get into that more so when we get into the actual X-rays themselves. I'll help you orient those kind of things. You can also do angiograms, where the patient will ingest certain colored dye and basically take pictures there. It gives a good idea of how well things will flow. So in this case, how well blood vessels can transmit blood or lymph. If there's any kind of kink there, we can kind of see where there may be some stenosis or some other kind of type of abnormality there. Mammograms to check for different types of cancerous lesions or different types of cysts. You look at intravenous urograms, checking for the kidneys. Barium contrast are used a lot of times for the intestines as well. And also use bone densitometries, which used for either checking for osteoporotic type of problems, although we use more DEXA scans for that there too. But it's also important there to look for any kind of metastasis in particular, or dealing with any kind of cancer of the bone. Any type of highly mitotic areas or high metabolic areas will show very easily on bone densitometry scan. MRIs I use quite often with our patients in particular. This is going to be a nice little corollary to the X-rays, where the X-rays are good for hard tissue. The MRIs are excellent for soft tissue. And without getting too much into the physics, very simply, we look at two different types of MRIs. One looks for water content within certain structures, and another one takes a look at fat content with the helpful use of very heavy magnets to basically help excite some of the molecules and basically on the density of those particular molecules found in certain structures, gives an idea of what kind of structure we're actually looking at. You will see some MRIs in the class, and I'll be able to show you what is normal and what's abnormal, especially when we get into the skeleton as well as different types of joints in particular. We may look at some MRIs for hips and also for shoulders too. CT scans, this is basically expanded X-ray. But it's actually more so for checking for soft tissue as well. A lot of times, a lot of hospitals, it's easier to do a CAT scan than is an MRI. Although for soft tissue, MRI is definitely the treatment of choice. But for example, when I mentioned before about the magnet in the MRI, if anybody has any kind of metal implants, or they've had, or let's say if you have a construction worker that deals with iron, you really don't want to put them into an MRI machine because that magnet will draw any kind of iron fillings that may be stuck in the eyes or stuck in other body parts, and of course that can cause some major damage to the person. Whereas the CT scan, although not quite as good contrast-wise as far as the MRI goes, it is safer to perform. Ultrasounds are great for showing real time, whereas before we're looking at the MRIs, CAT scans, and X-rays, that's just a quick little snapshot of a three-dimensional being in a two-dimensional image. So it takes it's quite an art form to learn how to read X-rays, MRIs, and CAT scans. However, for ultrasound scanning, we can actually see in real time. And those of you who have ever been into ultrasounds for infants, it's a nice way to see the baby move, through the image. You can see the heart beating and so on and so forth. We also use it for Doppler ultrasound. You want to check and see how well the blood vessels are conveying blood back and forth. Other types of imaging procedures that we use are going to be the angiographies, also PET scans used for the brain. So angiography used for checking how well the heart and how well the arteries, or whether they're defunct or whether there's any kind of stenosis. The PET scans are great to check for brain activity or lack thereof. Very important for helping diagnose different types of brain lesions, or let's say if we're looking at anybody post-stroke. It's great way to image and see how well certain treatments are helping out for any kind of brain or any kind of necrosis found in the brain. Endoscopy. Hopefully none of you had this done before. So very simply, an endoscopy is very simply when you go from the throat down. Basically, you put to sleep for this. Usually this gives also a good real-time view of, again, look for any abnormalities, any type of cancerous lesions, look for any kind of stenosis from peristalsis that may have gotten stuck. If it goes to the other end, it goes through the anus, is known as a colonoscopy. So very simply, you also put to sleep for this one too. So look for polyps or looking for any kind of interception found in the colon. But it's a very good diagnostic tool. I'll show you also if they look for a laparoscopy. So if they're going to do, if you're looking into a knee, they can use a small camera to check and see if there's any kind of fraying of the menisci or do any kind of cleanup work through an arthroscopy, usually through the knee or through the shoulders, sometimes through the hips there as well. So I misspoke. The laparoscopy is also for the organs, especially in the abdominal pelvic cavity. The arthroscopy is mainly for knees. Finally, we have radionuclide scanning, which is used to basically look at different types of tissues of an organ and check for any kind of cancerous, any other kind of highly metabolic activity. So in this case, someone is injected with a radionuclide or some kind of radioactive substance, and then it's transferred to that particular body part, and we use gamma rays to check and see if it's that radioactive substance is taken in by the cells themselves. Naturally, if it's taken up at a normal rate, we know the area is normal. But if it's a highly metabolic rate, like a very active tumor, then we know obviously it's a cancerous area there too. So again, this is another very highly involved and very precise type of scanning that's used for most oncologists. That ends Chapter 1. I'll be picking up Chapter 2 in just a little bit. If you have any questions regarding Chapter 1, please email me any of your questions. It's pretty straightforward. We will be going over some of this stuff back in lab. In particular, we're going to talk about the anatomical positions, the different directional terms, body parts, and we'll talk about some of the non-invasive techniques there as well. So I'll see you in Chapter 2.